Good morning. I'd like to talk to you about the Pathways to Equitable Healthy City project. This is a global partnership that aims to improve the population health, enhance health equity, and ensure environmental sustainability in cities through the co-production of knowledge and generate evidence with civil society partners. To provide timely, rigorous scientific evidence on how urban change and development can be directed and managed to positively impact the health of the people in the community and enhance health equity. The research activities in Dhaka involves co-production of knowledge, housing and neighborhood issues, dealing with poverty and inequality in urban areas, dealing with the water and sanitation and waste management, and the transport and mobility. The key challenges to progress in promoting urban health, particularly what we have noticed while implementing this project, are multifaceted actors and stakeholders involving different government agencies, and that complicates the cooperation and coordination and planning required in urban health and development programs. We also found that roles and responsibility of different actors and agencies are not clearly established, clearly noted there. And also one of the things we should mention that the pathways of research to policy, there has been a lot of research, but how this can be transformed into policy and taking all this evidence to the policy formulations in order to have the community engagement in implementing some of the research activities. Some of the challenges are related to the education, the local gangs in the community, the hooligans and influential communities, and leaders and representatives, which in some cases could be a threat for implementing some of the activities. We see there are political commitments, there are policy formulations and implementations are there, but what really happens is policy and policy formulations are mostly based on some short-term. It should be based on some long-term views. The other issue we need to mention is that because of the nature of the urban development, where we involves a lot of other ministries and others. So in all activities, it's important to recognize that health should be considered in all policies. In our experience, we have developed the community and our network. And the community involves the researchers, academia, government officials, city administrations, the city development authorities, all different ministries that are involved in urban development, the NGOs, the healthcare providers, and the private sector as well. What really we could get is that the stakeholders' views based on practical experience of working in each other's sectors are taken into account for generating policy scenarios. And that would be, if we can support with the modeling work and data synthesis, that will help us to develop these policy scenarios. In the process, we'll be developing a data bank which will help us to future projection and useful for the stakeholders. They will be able to gain access to the information which will enable them to make some impact on the policy changes. So gaps in actions and supporting research and information policies, we would like to mention with respect to this that the research that are done are fragmented manner, but all findings do need to reach the policymakers. There are a lot of the policies, but there are lack of implementations because there is a poor enforcement of the regulations. Funding are not sufficient, that's always there, but the important thing is sometimes the government is really addressing the urgent research, but this is another gaps we need to say that, well, we need to kind of prioritize those. So the dissemination of the research finding is also less extensive. And in the process of implementing this research, we could establish a very good, through our co-production workshop, we could identify the needs related to the waste management, waterlogging. We could help the thoughts being shared among stakeholders. We could develop a set of actionable policies and guidelines in coordinating and cooperating manners among the stakeholders, and also that enabled us to really what should be the suggestion of the holistic approach that should be taken. We could also help reduce the overlapping research and implementation activities, and all these activities has enabled us to reduce the resource the increase the resource efficiency, and in the process we could enable that what kind of a training for urban development community leaders are needed. So I would end here. Thank you very much.